right now and talk about your health, because cancer rates are climbing across all age groups, with particularly alarming numbers, the increases for younger adults. Early detection remains one of our most powerful weapons in the fight against cancer, and yet many people skip that crucial screening and don't want to talk about it, don't understand the risk factors here. So joining us this morning is Dr. Rhonda Randall, Chief Medical Officer of United Healthcare Employer and Individual. Thank you for joining us this morning, Doctor.
Thank you for having me.
So why are we seeing these troubled statistics about cancer rates with that young adult demographic particularly, Doctor?
We have started seeing increases in rates of particularly colorectal cancer and other forms of cancer in younger adults, which has led to changes in the recommendation to start screening for some of these cancer risks at younger ages. We know that there's certainly a tie to our lifestyle. And there are things that are out of our control, like genetics and family history. But those things related to lifestyle, you can modify those. The other thing that's really important is having a personal relationship with a primary care physician so they can have these conversations with you.
So when we talk about early detection, what do you mean, and what timing is the most ideal?
Well, the earliest you can detect something is the most ideal, right? When it is small, early to treat, hasn't spread. So don't have fear around getting early detection and maybe having a diagnosis that can be a little alarming. Those stage 1 cancers, for example, are much easier to treat. We're seeing cancer deaths in the United States decrease, although we're seeing incidence of cancer increase. So it's important to know that prevention matters. And also, staying up to date is important. Most of the cancer screenings are covered under preventative care at zero cost to you. So your out-of-pocket costs are generally zero for these cancer screenings.
There is a little bit of confusion between preventive screenings and diagnostic tests, right? Can you explain the difference there?
Yeah, this is really how your physician codes these tests. So either you have no symptoms at all, your risk factors are low, and they're doing a true screening. A diagnostic test is when there's a symptom, a risk factor. A common misperception is, for example, when you're going to get colon cancer screening and you have a positive result. There's blood in your stool on a non-invasive test, or there's a polyp on a colonoscopy. And that might be coded as a diagnostic test, which changes your copay, which is why United Healthcare now is making screenings and your first diagnostic test for things like breast cancer and colorectal cancer under that preventative care benefit, so that copay isn't a barrier for you.
All right, so what are the key screenings at different stages of life, and when should they start?
Well, there are more screenings other than cancer screening, so I'll say that. But again, having that personal relationship with a primary care physician is important because they're going to look at your personal risk factors. So in general, for women, you should be having cervical cancer screenings beginning at age 21. There are circumstances where that age is different. For most women, breast cancer screening, mammography at age 40. If you're high risk, it can be 35 or another age. And colorectal cancer screening is now recommended at age 45, for example.
All right. Beyond screenings, what can people do with modifying their habits or daily routines?
A lot of it is within our control and our lifestyle. So happily, we have seen the use of cigarettes in the United States go down quite significantly, but I am concerned that we're seeing an increased use in vaping and electronic cigarettes, for example. Those also carry the same cancer risk as cigarettes do, so it's important to stop that and talk to your doctor about ways to avoid alcohol use as another one. So heavy alcohol use is a high risk factor. Eating a balanced diet, we all know that. I love when people are reading labels and understanding what they're getting, what the portion size is, what the ingredients are. And movement is important for us as well. So 30 minutes of a walk 5 days a week, every other day, is terrific for our health and lowers our cancer rate.
All right, let's talk about patient empowerment. What should patients ask their doctor to ensure that they are getting the appropriate screening at the appropriate time?
Yeah, I think you just posed the exact question that they should ask, right? What are all the screenings that I should have? And again, more than just cancer. So we're looking at things like high blood pressure, high cholesterol, diabetes, obesity, and other things that immunizations and vaccinations are important conversations to have as well. But in particular with cancer, understanding your risks, being honest with your primary care physician. They do need to know, if you're not getting physical activity, what you're eating in your diet. If you are smoking or drinking, be honest with them about that so that they can assess your risk and advise you on the appropriate screenings at the best age.
And what message then to our viewers this morning who might be putting it off? I mean, what do you want them to know?
Early detection really does save lives. It improves your course of illness if they do find something. Cancer is curable in many instances when we find it early. And don't let that financial piece be a barrier, particularly if you're a United Healthcare member, where making sure that your first diagnostic screening is covered.
Anywhere people should go for more information, Doctor?
You can go to uhc.com for more information.
All right, Dr. Rhonda Randall from United Healthcare. Thank you very much. Very important message there for our viewers this morning. Appreciate your time.